Hello, I'm Dr. Damien Lafferty, a surgical podiatrist. Before we move into more specific treatments for ingrown toenails in future videos, I want to explain what an ingrown toenail actually is and how it develops. An ingrown toenail, also called onychocryptosis, happens when the edge of the nail grows into the surrounding skin. Instead of growing straight out, the nail curves downward and cuts into the skin beside it. This causes pain, inflammation, and in many cases infection. It most commonly affects the big toe, and it may involve one or both sides of the nail. Let's break the process down into three simple stages. Stage 1, the nail begins to dig in. Normally, the nail grows forward above the nail bed, but certain factors like nail shape, poor trimming, tight shoes, or repetitive trauma can cause the nail edge to press into the skin. This leads to micro tears, redness, swelling, and tenderness. At this early stage, it's usually sterile inflammation, not infection yet, but the area is painful and sensitive to pressure. Stage 2, infection develops. Once the skin barrier is broken, bacteria can enter the area. This results in redness, heat, throbbing pain, pus, and increased swelling. The swelling pushes the skin further over the nail, making the problem worse. This is the point where many patients first come to see me. Stage 3, chronic irritation and hypergranulation. If the condition continues, the body produces a type of fragile red tissue called hypergranulation tissue. It bleeds easily, releases fluid, and can grow over the nail edge. This tissue prevents proper healing and keeps the nail trapped in place. Once this develops, treatment becomes more complex and it will need to be addressed properly. To stop the cycle of recurrence, an untreated ingrown toenail often becomes a repeating cycle. The nail digs in, infection develops, hypergranulation forms, the skin folds over the nail, and the nail embeds even deeper. Unless the offending part of the nail, and sometimes the nail root, is removed or treated, the problem will keep returning. In summary, an ingrown toenail begins as a mechanical issue. The nail edge pierces the soft tissue. Infection then develops. Chronic irritation forms hypergranulation tissue, and this cycle continues until the nail structure itself is corrected, usually through a partial matrixectomy or, in some cases, a wedge resection. Thank you for listening. I hope this helps you understand the condition more clearly. I'm always happy to answer questions in upcoming videos.